Connie Seymour is a mother of 10 and has spent the last 35 years working as a server. She says cost and getting time off from work have prevented her from seeing a dentist in the last 2 years.
If you're not making enough to live on as it is, getting to the dentist is not a priority. Eating, paying your bills, getting to work every day, those are priorities.
Connie is one of 74 million Americans who lack dental insurance. That's 3 times the number of people who lack health insurance. She doesn't make enough to afford the insurance, but she makes too much to qualify for Medicaid. 2 years without a dentist have left her teeth in bad shape.
You have to pay for the dentist appointment. You have to pay for, whatever happens. And it wasn't something that I could afford to do. So I just went on without the fillings. So now it came down to the point where I had to have the teeth pulled.
Some clinics, like Primary One, offer discounted services for patients without insurance. Connie went to one of Columbus's only free clinics, Physician Care Connection, where she had 3 teeth pulled and a bracket for false teeth repaired. Eventually, she'll need another set of false teeth.
I'm missing almost the whole bottom row on this side. So that prevents me from eating some of the things that other people get to eat.
So what prevents people like Connie from seeing a dentist?
Data from the CDC shows that lower-income neighborhoods like Linden report the highest rates of tooth loss in the city at around 40 to 50%. Now, just as many residents report not having gone to the dentist in the last year. And that has a lot to do with being able to physically and financially access a dentist's office.
Throughout Columbus, the poorest neighborhoods, shown here in white, have the fewest dental clinics. The yellow dots represent dental clinics, and in the North and South Linden neighborhoods, there are only 4, and none of them offer affordable services for patients without insurance.
Compare that to more affluent areas where there are nearly 24 dentists. In Clintonville, just 6% of residents report tooth loss, and nearly everyone has seen a dentist in the last year.
I think people in poor communities struggle with physically accessing care. I know we talk often to patients that come to the school, was it easy to get here? And for some it isn't. Transportation. If you don't have your own vehicle or if you're not on a bus line, it's hard to get from A to B to C to get to the dentist. That's just a physical issue.
At the OSU College of Dentistry, patients can receive care from dental students at a fraction of the normal cost. As the only state-supported dental school in Ohio, patients travel from all over seeking root canals, dentures, and preventative care. Oftentimes, people who struggle to afford preventative services only see a dentist once an issue has become severe.
Last year, 60% of Americans that went to see a dentist went because they hurt. Not because they wanted their teeth white, not because they wanted braces, not because they had a broken tooth, but it was pain.
Many of these patients wind up in the emergency room. In 2012, a patient came to the ER every 15 seconds for a dental emergency that could have been treated at a dentist's office.
There are more medical clinics than there are dental clinics for folks, so it's a very complex issue. And I think importantly, it's even more complex when we're talking about prevention.
Mount Carmel often sees people seeking dental care at their mobile clinic, and they have to refer them elsewhere. Pearson says poor dental hygiene contributes to more serious issues down the road.
So it puts people at higher risk for cardiovascular issues like stroke and heart attack. And I really believe that a person who loses their teeth as a result of periodontal disease and doesn't have access to dentures is really dealing with a disability. And on top of all of the things that you might see, nutritional challenges will definitely exist because finding healthy foods that one can eat when you don't have teeth is a real challenge.
And a damaged smile can make it hard to find a job.
Employers are looking for folks that in their minds and in their perception will represent their organizations well. So most definitely when somebody comes in with issues of poor oral hygiene or they're missing teeth, it impedes their ability to gain employment and maintain employment.
If you're missing enough of your front teeth in particular, your pronunciation isn't quite what it should be. If you're missing all of your teeth and you haven't replaced them somehow, the support underneath the lips, it goes away and your whole outside falls in and it can make you look 40 years older than you really are.
Connie knows that when you're looking for work in the service industry, appearance is everything.
Especially with the job that I do. when they come in and they're missing teeth or they're just in bad shape, I see management not taking them because of that appearance, which is unfair. But I get it.
People like Connie need to see a dentist in order to make a living, but they don't always make enough to afford a dentist.
When I smile, that's the first thing I think about is, wow, they probably think I didn't take care of me. And it's not about not taking care of me. You know, there's rent, there's utilities, there's car payments, there's insurance, there's gas you put in your car to go back and forth to work, there's food. Even though I'm out there working and it looks like I should be banking, I'm struggling. I'm past struggling right now.